Yes, Dr.
I've
O'Deal.
used it a couple of times, but with a sugar pill added.
Sugar pill added?
Yes.
Mm-hmm.
Just a plain sugar pill, telling them that they're going to get right away well, and they do.
Mm-hmm. Mm-hmm. Oh, it works. There's no doubt about it, and it works very beautifully. Where you're working with a virgin girl, usually the suggestions will last for months and months and months and months when you're working with dysmenorrhea, and a suggestion is given. But where you were working with a bachelor girl or a young bride who is worried about having a baby, then you'll find that each month you have to renew the suggestion, because those people look for the premenstrual cramps and tensions as, this is my lucky day, I'm all right this month so far. So if you think for one moment that that isn't true, watch over the years how that will happen to you, and will absolutely floor you. Particularly is this true of the young bride, the bachelor girl, and so on. If they play around at all, these bachelor girls, they look upon their approaching period as proof that nothing's happened to them this month. And brother, they welcome dysmenorrhea. This may be what Dr. Millikan is saying when they don't want to get rid of the symptom. I've never found out, to my satisfaction, that giving post-hypnotic suggestion, or giving the suggestion in advance that this month's period is going to be easy for you, is of much advantage. I don't find that it's of any advantage at all. I give the suggestions when they have the dysmenorrhea. That may be another thing, Doctor. Were you trying to do it for a period that was approaching on these cases that you're talking about?
I've tried it all.
Yeah. Well.
Various times.
Yeah. All right. Let's get on to another phase of it. The problem of amenorrhea usually yields readily to superficial suggestion given in somnambulism. Gentlemen, I say this to you in all sincerity. I have said in every class, and those of you who are my old students know this, that once you know how to give an amenorrhea suggestion, if you ever fail with it, I want to hear from you. How many have given suggestions for amenorrhea? Have you ever failed with it?
No, you can give waking suggestion and get results with that.
No. There, you see that? You'll never fail with an amenorrhea suggestion. With perfect confidence, I say to every one of you, have you ever failed with an amenorrhea suggestion, knowing that nobody is going to fail with an amenorrhea suggestion? I can remember this incident happening in Brooklyn. We were doing hypnoanalysis that night, and the patients were waiting outside, and as each patient was brought in, I would work with one patient, then that patient would go out, and another patient would be brought in, and so on. Now we bring in some woman, and as she starts approaching the chair beside me, she starts saying, well, I don't know if I'll be able to relax tonight. She says, I've got such a feeling of tension, just like a tire around my stomach. And she says, I always get that feeling whenever my period is due, and I haven't had my period for about, I don't know, 8 months, 6 months, 5, I don't forget what she said, but I haven't had my period for about 8 or 9 months. And by this time she's seated in the chair. And so I said to her, well, that's the first thing we'll have to take care of. Then we'll have to see that your period begins. So I put her into somnambulism and gave her the suggestion that the following morning at 8 o'clock, her period would begin, and she would have a most normal flow for 4 or 5 days. At the end of the 5th day, it would cease, and her system would feel so much better for it. And then I proceeded to do the hypnoanalysis. It was all done very casually. When the whole thing was over and she was on her way out, and we'd called in the next patient, he says, wait a minute, the doctor says, wait a minute. He says, Dave, do you really expect that to work? And I said, expect what to work, doctor? Because I'd forgotten this part of it. He says, that amenorrhea suggestion, you mean to tell me that that woman is going to start her period at 8 o'clock tomorrow morning? And I said, sure, of course she will. I've given that suggestion over 300 times. I have yet to meet the woman who will break the chain. There's no reason why she should break the chain. She'll start flowing in the morning. You don't have to worry about it. So I said, incidentally, I've never known an amenorrhea suggestion to fail, doctor. And now I forgot about it. But now it was the following week, and I was coming in a little bit late, as I did today. Quite a number of doctors were there before us. And as I came in, here's this doctor and the others, and they're waiting for us. Oh, Dave, you failed last week. Boy, you missed last week. You missed but good. So I said, what happened? What are you talking about? He said, about that amenorrhea case. Remember you told her that the following morning she started flowing at 8 o'clock? I said, yeah. Yeah, I told her that. He says, well, she didn't. And I said, she didn't? He said, no, sir, not until 9 o'clock. Now, of course, there was a big laugh. But I want to tell you something, that's as close as I ever want to come to failing with an amenorrhea suggestion, because if she had gone another half hour or so without starting to flow, she would have believed that the suggestion was not going to work, and therefore she would not have had her period. I don't want to fail that much with an amenorrhea suggestion. That's as close as I care to come to failing. You will generally find this if you've given an amenorrhea suggestion, that if you say they'll start flowing at 9 o'clock, they'll start flowing at 8 o'clock or 7 o'clock. You always about an hour or two before you say. Is that true, gentlemen, those of you who have given suggestions?
My experience with that is mostly with some mother bringing in a girl, and she has menstruated now for 3 weeks, and she's actually, I think there's a fear there that the girl got tuberculosis, or that's another feeling.
Mm-hmm.
Or that something is wrong physically.
Mm-hmm.
And she's menstruated 2 or 3 times in her life, and then she's
stopped.
Mm-hmm. That can be passed off, and that's a natural thing, and that's
mm-hmm. Yeah. You can, though, nominate the actual time.
I get is to have them call and say, say that really works. You know, I started 5 minutes one way or another.
Yeah.
Yeah,
but it's usually 5 minutes one way or the other. It usually isn't an hour, is it?
No, it's right.
It's right up.
It's not way early. It's right around.
Yeah.
It's about the time we've given them.
Well, over the years, I have found that it's usually around a half hour to an hour early. They'll show signs about a half hour to an hour early, and the real flow will start right at about the time you mention. But they will start staining just a little bit earlier than the time you mentioned.
I made the mistake of trying on a patient who turned out to be pregnant.
Oh, well, you'll never bring about an abortion through it. That's a cinch.
Has anyone ever used this, the sterility cases that have this very irregular cycle that it's hard to pinpoint the time, to make these cycles?
Oh, yes, you can make the cycles regular with hypnosis, yes. And many doctors have done it.
You got to do it every month.
Huh?
You got to do it every month.
Sure. You can put them on a 4-week cycle, and they do very nicely. Now, look, you must understand how to give an amenorrhea suggestion, or you can flop with it just as much as you can flop with any other phase of hypnosis. When you know where the cycle is, then you give the suggestion that it's going to occur at such and such a time. Let me explain what I mean. Here's this woman coming into the room saying, I get this tight feeling around my stomach every time my period is due. So I knew her period was due. I knew where the cycle was. Suppose she hadn't made any such statement as that, but it said that she hadn't had a period for 8 months or 11 months or whatever the case was. I would then give my suggestions like this. 5 days from today, at 9 o'clock that morning, this is May 3rd, isn't it? I would say on May 8th, 9 o'clock in the morning, you will start to flow. You will feel so good as a result of this normal action of your body. Your entire system will feel better for being cleaned out of the necessary parts that should be eliminated at this time. And you'll feel so good. And you'll await and expect that period at such and such a time. And you will have it exactly at the time I've indicated. 9 o'clock, 5 days from today. Now, you do that in order to give the mind a chance to fasten on something and recreate the cycle, and you will find that they will actually recreate the cycle, and this is definitely attested to not only by myself, who have done it again and again, but by books written, well, Kroger attests to it in his psychosomatic gynecology. Also, many people attest to it. Where you don't know where the period is, don't say you're going to begin flowing tomorrow morning at 9 o'clock, because you can't make it happen like that. You've got to give the body a chance to assemble itself, to get ready for the period. And then it will happen very beautifully.
No, but what would you do with a woman who is probably having her last period? She comes in and wonders why she doesn't go ahead. And maybe she never will have another period yet.
You mean when she's hitting middle age? Yeah.
It's the biggest worry there.
Well, I wouldn't do anything about it, doctor, because then it's aside from anything that has to do with hypnosis. When it gets to be menopausal, although in many cases you can, doctors attest to it. I don't know that it's wise, but I don't know that it's unwise. You can suggest to a woman in menopause that she will have normal periods, and she will proceed to have normal periods for a little while longer, but they'll shorten up and shorten up and shorten up until finally there just won't be any. It might bring about a more normal change, but I just haven't been sold on that type of suggestion, so I've hesitated to give it. When a doctor says she's in the menopause, would you give her suggestions that she'll have a period? I say, what good is it? I mean, that's what my thinking is, but I may have just a layman's thinking on it. It may not be good. You would have better knowledge than I would have on that, doctor.
Last year I delivered a 16-year-old girl under hypnosis, and she came to my office last week. She said she was 3 weeks late, and I suggested that I could give her this Amenorrhea Suggestion, and she said, well, it didn't work. I've already tried it. And so then I proceeded to give her an injection of prostigmine. And I just gave her one injection, and she didn't take the whole series of the 3, and she has started a period.
Mm-hmm.
But why did her saying that she had tried to give herself a suggestion not work?
Well, because how would she know how to give herself a suggestion?
Well, when you hypnotize them, don't they do it themselves in a sense?
Yes, but they don't know how, and they're not sure of themselves or anything else. Would have been much better if you'd have put her in hypnosis and given her the suggestion.
But she wouldn't let me do that.
Well, then you did the right thing. Yeah, but you could have given her water.
Yeah.
Friends, let's get over to the nausea and vomiting of pregnancy.
Mr. Gentleman, I'd like to bring up one thing. I don't know if you covered this in the outline here. Now, how about hypermenorrhea? Are you going to cover that at all?
No, I don't know it. I don't know that from the angle of hypnosis, doctor.
It does beautifully.
It does beautifully, huh?
Yeah, if you, now I've only used it where I know there's no organic pathology, but I've taken patients who definitely are having a hypermenorrhea from an anovulatory aspect, where you can actually get enough cervical mucus at one time or another during this flow they're having. Now sometimes if there's a lot of blood you can't get it, but if you can get enough mucus that you can determine it's anovulatory, I've stopped them on that type, and I've also stopped them on ovulatory type, so I know they work on both types. And I know that girls who have excessively heavy periods and who have them for an excessive number of days, both from the standpoint of they have a 5-day period but it's terrific, and from the ones who have a fairly normal flow but it lasts out 8 to 10 days, that you can bring those 8 to 10 day periods down to 5, and you can get the ones that are flowing very heavy and you can cut them off. And I've done that too many times to believe that it's due to any chance.
Yeah. It isn't coincidence. It has to be.
Yeah.
How do you give the suggestion?
I just give them the suggestion that depends on where they are in the cycle, and you kind of have to kind of feel, I mean, where they are in the period, you have to kind of feel your way along and be an opportunist, I guess you might say. But if, well, I had one of the nurses at the hospital where one of the hospitals where I do some work, who I had done a DNC on 2 weeks previous for hypermenorrhea, and there was no real pathological situation. There was strictly hormonal imbalance. Then I put her on hormone therapy, and she came right back and broke through on hormone therapy and started really pouring out. And I just ran her through into somnambulism and gave her the suggestion, the thing I heard before, I think the physiologic, on the basis of this heart control, I think the physiologic approach has some merit to it, in which I told her that within the next 24 hours that the tone of her uterus was going to definitely improve and that her blood vessels would start constricting. And as these changes took place, her flow would slow down, and within 48 hours it would be completely ceased, which was a rational time for her to quit her flow. And it did quit. Now, it wasn't quite as pinpoint as starting it. I think it drug on for 52 or 60 hours or something like that, but it was very reasonable. It was certainly well within what I was satisfied with. And she stopped, and now she hasn't started flowing again. And I'm checking her out on cervical mucus now to see where she is, but she definitely stopped, and I've had a fair number of cases who have done that.
I'll tell you another thing that you can do. I'll take your question in just a minute, Ms. Waxman. I'll tell you something else you can do. We don't generally discuss in class, but you can do it if you people are interested. You can lengthen a period or shorten a period by suggestion. In other words, if you don't feel that the woman is having a normal length period, suppose she's having, we'll say, a 7-day period, and you feel that this is too much for her system to take, you can shorten that period to a 5-day period or a 4-day period and get a complete cessation. This has been attested to again and again and again. We used to include this as knowledge given in our sexual problems, in which the use of hypnosis is indicated. But I had a talk with some of the doctors, and they said that isn't very important information. And so I've left it out in recent years. But believe me, this works, and works beautifully. And maybe this might cover your hypermenorrhea that you're talking about. Because wouldn't a 7-day period naturally be one that would be hypermenorrhea? Wouldn't that be hypermenorrhea?
Well, it definitely could be, and that's what I'm saying. You can bring him back to a 5-day period for sure.
Sure.
And you can cut down the amount. And I want to say one more thing. I'll say it with tongue in cheek, and I'm sure there'll be some raised eyebrows. But you remember the girl I brought over that had put herself down to the coma for this kidney procedure?
Oh, yeah.
She's really been working strongly on auto-suggestion. And so she's real good at this. And the last couple of periods she's had have been 7- to 8-day periods with 2 boxes. And she called me last week and said, "My God, I'm scared to death." And I said, "What's the matter?" She said, "Well, I said, I'm going to quit messing around with this self-hypnosis because I started my period. And I just relaxed myself real deep and kept giving myself suggestion it's going to stop." And she said, "It stopped.
Sure.
This is 1 day." She's pregnant.
Yeah.
So then the next 2 days she spotted, but that's all. 1 patch for the whole day.
Yeah.
So I've been checking her out since then, and she's coming around through normal cervical mucus, so she definitely isn't pregnant. And at least we've got 1 period that she stopped and scared her to death.
Yeah. But you can stop a period almost in its tracks by the use of hypnosis. Yes, doctor?
You can stop a great deal of that excessive bleeding because by just simply suggesting that they'll have uterine contractions and be more or less tonic contractions. But however, that wouldn't rule out multiple submucous fibroids as a cause of this, which I think is really maybe a rather dangerous procedure that you're doing. You may miss something else.
No, doctor, because you wouldn't be able to affect it in case that it's tumors affecting it. You'd find your suggestions.
Amenorrhea for submucous fibroids, and it'll keep coming. But you can stop that with hypnosis. You can produce a terrific contraction that will be tonic, and I have done it in cesarean section. And in fact, the uterus contracted down, and I forgot to relieve her of it. And about 4 hours later, I was called back that she was having such cramps, and she says, "That's worse than having the baby." The cesarean didn't bother. But morphine would not stop it with Thorazine and all of the relaxing drugs. And it dawned on me that I'd never told her she didn't need to have those. I did tell her during the operation that she to prevent the bleeding. During the time, just immediately after the placenta was removed from the uterus. And the assistant said, "For heaven's sake, look at that thing contract." And it never stopped contracting. We still got the uterus. It was contracted and hard, and she never had any urge about anything contracted. This thing, though, she kept it contracted. She was preventing that uterus from bleeding for several hours, in fact, practically all night. When she was re-hypnotized and told her she didn't need to hold that uterus contracted anymore, that there was no more bleeding, there was any spotting whatever. And then when she woke up, came out of it, she didn't have any more contractions. So,
Yeah. Doctor, you will...
Question, and a question. The problem of breastfeeding is the one that is bothering most pediatricians and most OB and GYN and general practitioners and that sort of thing. And I think that most of us agree that so often it is on an intensive basis.
It is.
Have you had any reports on, again, the suggestion of relaxing the mother with the idea of feeding the baby? How does it work?
Yes, doctor, it works so beautifully in so many, many cases.
Well, do you have
I can't give you any series of experimentations on 500 mothers or anything like that, which I'd love to be able to give you, Honor. But the reports of the OB/GYN men in that respect, and some of the pediatricians, as far as that goes, has been to the effect that they can get this beautiful relaxation, that the mother nurses so much easier, and the starting of the milk flow and everything else is so much easier. I even have it on an interview with a doctor who had given a suggestion prior to delivery that the flow of the milk would be so very, very easy for her. And my gosh, within a few hours after delivery, she was ready for nursing. And usually it takes, I think, a little while longer than a few hours before she's ready, isn't it, Doc? Yeah. It's right on the record. In fact, this was something that I noticed on the record, particularly because when the doctor brought this tape recording to class, see, it was the first coma delivery that he'd ever done. He wanted to have a record of how it affected the mother and so on. And he talked about the fact in the record that she'd had a very easy time starting to nurse the baby. And she said, yes, apparently the suggestions that you gave me before I had the baby made it very easy for me to nurse the baby once the baby was born, and I was ready to nurse him just a short time after delivery. Some of you who have done some deliveries with that type of suggestion, doctor, when you do a delivery, do you give that suggestion beforehand that nursing will be very easy for her and so on?
Well, that comes on the OB record.
Yeah.
Now, the ones that I've suggested as far as breasts are concerned are the ones who didn't want to nurse and had terrific engorgement. I've had real nice results with suggestions for relief of the engorgement, evolution of the breast, and return to normal. I haven't worked with the other ones.
But you have found that they nurse very easily, though.
Yeah, I have no complaints on it.
Yeah. I don't think, doctor, that when you do a hypnotic delivery properly and condition it properly, that breast flow has any problem at all.
Well, so very often I probably see, 450 newborns a year. And out of that group, there's probably a dozen women who can nurse their babies. But there are probably half of them who profess that they want to nurse.
And
Would the suggestion at the time postpartum be given in the first few hours?
Oh, yes, sure it could. Postpartum. But I wonder if the suggestions would hold, we'll say, a week or two afterwards. Suppose they haven't started nursing, but they've just started right off the reel with baby food or whatever they feed these babies, these mothers who
I'm
reject.
thinking of the mother in the hospital who professes to want to nurse but is unable.
Yes, you can give a suggestion, doctor, that the flow of the milk will start. I've never had what satisfies me as a scientific evaluation of how effective it is, in how many cases, and so on. Is it 80% effective? Is it 70% effective? Or is it 15% effective? I can't tell you that too many times, doctor. I hit into situations like this where we cover something, and then the doctors have forgotten that particular phase of it, or who have never found it necessary to use that particular phase of it. So when that thing comes up, they use the thing that they've used in medicine for so many years without ever realizing that this has been covered in class, and that they've got a very good technique if they would only use it. Mrs. Waxman, I have ignored you for so long. I'm sorry.
I have this question when you were talking about excessive periods where you flow excessively. When you treat them with hypnosis, Dr. Berkel mentioned too, do you have to do that again and again every month? They have to come into the doctor every month?
That's a medical question. I wouldn't know. Dr. How about that?
I think I haven't been doing this too long, but the impression I had so far is that you don't. But now I say I haven't been doing it for a long time.
I don't have any.
There's so much of this doggone field that I just can't investigate every phase of it. I mean, I have to center my attention on some particular thing and work on that until I'm satisfied.
Yeah, there's a question that I am not. It's a good, valid question that she has asked, and I don't have the answer. I don't have the answer. Maybe one of the others have the answer for that. Yes, Doctor.
There was one question. I read James Monroe's book, and in that book he suggested that he treated fibroid tumors of the uterus by giving the suggestion that they would decrease in size.
Yes, I've done that.
And over a period of a year's time, he actually felt that he had decreased the size of the fibroid or eliminated it entirely.
Yes, well, now...
Is there any credence to that?
Let me tell you, I had an experience like that in Harrisburg, PA. I don't even mind mentioning where it was. I have a doctor who specializes in spastic children. And she's a very wonderful doctor when it comes to spastics. In fact, people bring her patients from long distances. And some of you may know of her. I don't know if she has it now, but some years ago had a terrific tumor. But when I say a terrific tumor, you could actually see by her shape that she had a tumor. And for some reason or other, she is mortally afraid of surgery, or was at this point. And she asked me what I thought about giving suggestions for removing this tumor by suggestion, by asking it to decrease in size. So what I did was to do hypnoanalysis on her to find out the cause of the tumor. This may sound silly to you, I know, Doctor, and I'm not, you can all take it as just a lot of nonsense, but I have a feeling, along with Butchnecker and various other men who are pretty advanced in their thinking, that many times we nominate our own illnesses. And when I got back to what I thought was a valid cause why she would want a tumor at a level below consciousness, then I tried to bring this to the attention of her conscious mind and told her that now, just as she had made it possible for this thing to grow in her body, now she could find that she could reject the tumor, and that the tumor would get less in size and less in size and less in size. This worked so well that she had an examination several years after this work was done. And the tumor, there were still signs of it, but it practically vanished. Now remember, I wouldn't have done this if she hadn't just declined surgery, and if she hadn't begged me to do it. And I feel that I was very successful in that case. Now, that verifies what Monroe said. You may or may not realize it, Doctor, that many of the things which I teach in this class are Monroe's thinking. And so that whenever they would reprint that book, there's so many doctors that could benefit by this man who was, in my estimation, so many years ahead of his time. Anyone who would suggest away a tumor you'd think was crazy. But when Monroe says, in all honesty, that he did it 5 times, and I've read other papers from other men that they believe they have done it, I thought, well, there's no harm in my trying it, especially where the woman is constantly under doctor's surveillance, because she's a doctor herself. And they say that I was very successful in getting the size of that tumor down. Whether I got rid of it entirely, I don't know, because I never saw her inside, so I don't know.
To reinforce the suggestion?
Oh, Doctor, I worked with her. What Pauline and I did, every time we went through Harrisburg, even after classes ended, I would make a date, and we'd delay our trip for an hour, while I just put her into deep somnambulism and gave her suggestions for the reduction in size of this tumor. This kept up for quite a while. I can't say that it works, Doctor. I can only tell you what that experience was, and I don't even know now. Did she ever have an operation or didn't she? I don't know.
Still living.
Oh, God, yes, I should say so, and very much in health.
I'll ask one question here. Do you know if any work has been done in the instigation of ovulation through suggestion? Are you acquainted with any work at all that's been done with this?
I don't know, doctor. That's so much in a medical field aside from what I would ordinarily know anything about that I don't think I've ever inquired of doctors if they've done that. No, I haven't got any information for you on that I could be satisfied was right.